Episode 16. Chemotherapy is a form of cancer treatment. It doesn't kill.
Today in my episode, I'm going to talk about some of the side effects of cancer treatments, and sometimes I'll mix it up with my experience. And so today I'm talking about the big word, scary, chemotherapy. And a lot of people go around saying chemotherapy kills. If you want my opinion, chemotherapy is horrible. You wouldn't want to go through the side effects. It's not easy going through it. The diarrhea, the throwing up, the lack of appetite to eat, depending on your system. Like when I was going through it, I was adding weight. And when I asked, I was told that it does conserve water in the system. But there are some that when they are going through chemotherapy, they become very, very thin. And probably it's because they have not been feeding well. I think that's one of the things. And the side effects became severe. But in my own case, I was eating, I think apart from the 2-3 days that I am under the weather because of the side effects, I am good all the way and I eat. And I make sure that whatever I eat is balanced diet. I take a lot of fluids, blend fruits and vegetables. And when I'm taking them, I am conscious of the fact that I need to rejuvenate my cells because chemotherapy kills both the good and the bad cells. And of course, people are scared about it. And I have heard so many people saying chemo kills. When you take chemo, you die. Please just disabuse your mind about that. Chemotherapy doesn't kill. And the doctors are very, very, very careful not to administer, the dosage that is beyond you. And that is why before you even start the treatment, the recommendation is that you go for full blood count, you go for a lot of, things, yes, tests to make sure that your system can even carry it. And if your system cannot carry it, they will never give it to you. But if your system can, then be sure they will give it to you. And so I plead with us because I have realized that some cancer patients, especially in Nigeria, sometimes they are not even honest. I was told about someone that the full blood count was not enough, that it wouldn't carry the chemo. After they gave her the result, she used her biro, corrected it so that she can go and take. Why do that to yourself? We take unnecessary risks with our life. Yes, you want to take the chemo and go home. But if your system cannot carry it, please don't make that mistake of taking chemotherapy, radiotherapy, any of the treatments at all. In fact, already we are even over-treated because some of these drugs were not tried on us. And so when you now decide to consume and you even consume it when your body is not fit to carry it, that's when it becomes dangerous. So please, always adhere to what your doctor says. One of the things about the oncology unit is that they are always careful because a little mistake can cause a great and irreparable damage. And so you see the nurses, the doctors making sure that they stick with the rules. So please try as best as you can to see that you obey and follow through. And please, while taking your chemo, make sure you try and eat well. Even before you go to take the chemo, have your food. Eat very, very well. And after that, take a lot of water. By taking a lot of water, you neutralize the toxicity. All these things are very, very toxic. And so, yes, they have different side effects, depending on your system. Some people, their hair fall off. Mine fell off. Actually, I had all the side effects. The only one I didn't have, I was never anemic. And that was because I kept on blending green vegetables and taking them. And I didn't have that problem. But I had low white blood cell. And I was given a boost, filgastrin. And I was also, at a time, I was placed on augmentin tablets for that. And so, if you adhere to the rules, you will definitely be fine. So please, go ahead with your treatment. Take care of yourself, and God bless you. Cheers.